Ladies and gentlemen, I have the unique privilege of introducing a great man and a physician and someone who I think is destined to become a historic figure in the history of the United States. Our next speaker, Dr. Ron Paul. Dr. Paul is a 10-term congressional congressman representing the state of Texas. Dr. Paul graduated from Duke University School of Medicine before proudly serving as a flight surgeon in the United States Air Force during the 1960s. In 1968, he settled in Texas and opened an OBGYN medical practice, performing over 4,000 obstetric deliveries. I first learned of Dr. Paul on the internet, and I read of his positions on personal freedoms, liberty, the Constitution, especially his positions regarding healthcare freedoms and his stance against overreaching and overarching authority of the FDA. Exactly. Dr. Paul is considered by some to be a dangerous man in that he espouses ideas so revolutionary that he is among the most suppressed persons in America today. And when I asked for a show of hands, I really wasn't surprised that half of you really didn't know about Dr. Paul, despite the fact that he is one of the most prominent physicians in America today. He is one of the most suppressed persons in America and today because of his revolutionary ideas. And when I say revolutionary, I mean circa 1776. In that Dr. Paul is the leading advocate for personal liberties and healthcare freedoms in Washington today. His positions are routinely deleted from national television broadcasts and from major news networks. Dr. Paul may be the most blacked out national figure in our country. That is because, and that is why, it is such a great opportunity to hear Dr. Paul speak live and uncensored here and now. Next, you will hear a new view for the future of medicine, one which aims to help restore our country and its people to a time of personal freedoms and a time when our bodies and our decisions regarding healthcare choices belong exclusively to the individual and his personal physician advisor. I am proud at this moment to present to you the Honorable Dr. Ron Paul.
Thank you. Thank you very much. Thank you. Thank you very much. I appreciate that. I'm very delighted to be here today. There is a campaign going on, and yet this speaking engagement was started, and it was settled a long time before the campaign started. We've been in this campaign almost for a year. But you know, like so many other things, I'm very much in favor of freedom of choice, and that's what our Constitution was all about. And yet today we live in an age where we've essentially lost freedom of choice. We've essentially lost our privacy, and we have lost the protection of our Constitution. We live in an age now, especially in the age of the post-9/11 episode, where our personal liberties are under systematic attack, whether it's personal civil liberties or whether it's the liberties for us to make choices in medical care. But many of these attacks on our personal liberty have been going on for many, many years. It's just that it was accelerated after a 9/11. You know, when there's a crisis on, it's an excuse for those who like big government. And many plans were laid even before 9/11 to intrude into our privacies, but it was used as an excuse. But if there is a war going on, if there's a war in Iraq, if there's a war on terrorism, or war on drugs, or a war against poverty, then there's this temptation for individuals to sacrifice their liberties. I have come to the firm conclusion, no matter what the circumstances are, there is never a need to give up any liberties for safety and security. But generally this is what happens. People in government that like big government, they build up fear. And if you're fearful of your economic future, which they used during the Depression time, which ushered in the age of big government welfareism and socialism that we've come to accept. But they usually talk about fear. And, of course, in medicine, the fear and determination that you're going to be left without being able to pay your hospital bills. Therefore, there is a need for government. And yet, when I started medicine in the early 60s, there was very, very little government involved in medical care. I can recall working in a hospital in San Antonio, Texas, while I was in the military. And I had volunteer duty, and I wanted some extra training, and I wanted a couple extra dollars. And I worked for all of $3 an hour, covering an emergency room all night long. And I never saw a patient turned away, and it was a church hospital. And yet, in spite of those conditions prior to 1965, we as a people said, there's too many problems with medical care. We need government in medical care. And from 65 on, especially in the early 1970s, we ushered in laws that distorted medical care. It turned it into managed care. And a lot of people claim that free markets and free choices have failed over these last 35 years, but that is not what has failed. What has failed is government managed care. You know, once government gets control of the dollars, and they control all our dollars because the assumption is made with our current tax system that the government has control over 100% of all our money. And that is the principle of the income tax. They control 100% and they allow us to keep a certain percent under certain conditions. This is why in my struggle to return freedom of choice to all of us that we have to deal, of course, with the tax code and get rid of the income tax and make sure that we spend our money the way we want. When the government spends our tax dollars and our medical dollars, it means then they control our medical care, and that is essentially what they have done. Through the tax code and the ERISA laws, they have created this managed care system which has become corporate medicine. Corporations run our medical care. Corporations are the intermediary now. It's not a doctor-patient relationship. So the dollars flow to Washington and then they're distributed to the corporations who make big dollars on Wall Street, whether it's the drug companies, the insurance companies, the HMOs. There's a tremendous benefit to those who lobby Congress. So lo and behold, when there's a prescription drug program before the Congress, guess who spends all the money? Is it the poor people who say, I need help? They may need help because of a consequence of a bad government program, but they're not the lobbyists. It's the drug companies that come and lobby and demand these new programs. But a good example of how this works, once the government gets control of paying the hospital bills, then they want to control our lives. They will tell us, well, you know, if you're in an accident and the government has to pay the bills, the government has to regulate your behavior. So therefore, to cut down on government expenditures, we are going to mandate that you wear helmets and wear seat belts, which may well be good advice, but it becomes a mandate from the government because they pay the bills. That's the motivation, because they have to regulate and distribute health care, and then it comes in further intrudes on our personal choices. But not only that, on these safety measures, which may be good, they also come in and they start dictating what kind of medical care the individual can pick, because they who think they're such experts at the FDA and the FTCs and the government bureaucrats and the politicians, they're the ones who come up with the idea that we know what is best. Preventative health care and nutrition and alternative care, that is not to be paid for the government, but what we'll do is turn it over to the individuals that control the drug industry. That is what has to be reversed, that attitude. Healthcare in the last 35 years, since the government has really gotten involved in, has deteriorated. In my lifetime, in the time I've practiced medicine, the quality of care has actually gone down. Not in all areas. There's many areas that health care has improved, emergency care and some other things. But overall health care for the people of this country, I don't believe has improved. But I know one other thing that has happened is the cost has